True success is not in the learning, but in its application to the benefit of mankind. For Thailand, non-communicable diseases (NCDs) are a major health problem that all relevant sectors have been aware of and attached importance to it continually until today. At present, efforts for addressing the problem focus on multi-sectoral collaboration to ensure efficient, timely, and integrated actions that will lead to learning towards people's well-being. Tobacco Cessation for Patients with NCDs by Physician Networks. Thailand has been conducting campaigns against smoking continually through collaborative efforts of the public, private, and popular sectors, especially in making smokers realize the harmful effects of tobacco use. Here is Paolo Hospital Pohonyotin, or Paolo Memorial Hospital in Bangkok, a tertiary care private hospital. It has a good example of campaigns for smoking cessation that have been conducted in a concrete manner continually since 2009.
บุหรี่เนี่ยทำให้ปอดเสียหาย
Dr. Araya Tongpiu, Diabetes and Endocrine Specialist, Paolo Hospital, Pohonyotin, and committee member of Thai Physicians Alliance Against Tobacco. Previously, we did not have much knowledge about tobacco cessation. According to our past experiences, right after advising a patient to quit smoking, the patient was seen smoking. We then realized that the doctor did not teach the patient how to quit smoking. So, when I met with Professor Emeritus Dr. Somsi Pausawat, President of the Thai Health Professional Alliance Against Tobacco, THPAAT, I was asked to join the Thai Physicians Alliance Against Tobacco in campaigning against smoking. Getting interested in this issue, I began learning about smoking cessation methods and experimenting them at the hospital. Some staff members were sent to learn more about the methods. As they were found to be successful, many other professions were invited to join this effort. Today, the group has become the Tobacco-Free Committee of the hospital, comprising doctors, nurses, multidisciplinary health professionals, and staff of other sections in the hospital.
แพทย์ดูคนไข้วันหนึ่งเป็น10
At this hospital, importance is attached to service recipients. So they have to really know and understand the harmful effects of tobacco use or smoking as the risk factor of non-communicable diseases, or NCD. Many people know that tobacco is harmful to health, but they never care about smoking cessation. They do not know how smoking adversely affects their health. Before meeting with the doctor, patient's history taking is important, especially for those who are smokers or have NCD risk factors. While having a medical examination and treatment, patients with a smoking history will be informed in detail about tobacco-related health risks and illnesses, as well as alternatives for smoking cessation. The patients are encouraged to join a smoking cessation program of the hospital's Smart Quit Clinic, Fa Sai Clinic, a one-stop service approach derived from the Thai Physicians Alliance Against Tobacco.
คือบุหรี่เนี่ย
Dr. Tasana Pong, cardiologist, Heart Center, Paolo Hospital, and chairperson, Tobacco-Free Hospital Committee. Now the role of the doctor is to explain the dangers of tobacco and illnesses to the patients, that they may have tobacco-related illnesses if they continue smoking. Toxic substances from tobacco are the major cause of acute coronary syndrome, or heart attack. We will give preliminary advice on smoking cessation, and follow-up care will be provided by our team members. Our treatment for tobacco dependence is free of charge. For smokers who have had an illness, the cessation can be easily initiated, but it is hard to persuade those who have not had any chronic illness.
อวัยวะต่างๆของร่างกาย
To Today, we are holding a training session for multidisciplinary professionals of the hospital on tobacco cessation methods and management, using the 5A interventions to identify smokers and provide addiction treatment until the smoker can quit smoking. The hospital is also a site for training and study tours for relevant personnel from other Thai and foreign hospitals. The program focuses on training them to be tobacco cessation providers and instructors.
อยู่ที่จิต
Dr. Kanitha, psychiatrist, Paolo Hospital. This step is very important as the doctors cannot work alone, and they have a very short time to meet with the patients. Both nurses and other multidisciplinary team members will have more time on a continual basis to inform the patients about tobacco-related health risks and treatment procedures. Pawini Jai Ur, nurse and resource person, Diabetes Center, Paolo Hospital. As for nurses, we have more time to see and talk to the patients than the doctor. Using the knowledge gained from the training, we can educate and motivate the patients who want to quit smoking. We are involved in all the 5A principles, which are very important. For certain clients, despite wishing to quit, after actually quitting for a while and socializing with other smoking people, they will begin smoking again.
ครั้งแรกเป็นหลายการทดสอบ
Mr. Amnad Kambradap, stretcher pusher. Upon quitting smoking, I felt good and stronger, not feeling weak. But after resuming smoking again, due to personal problems and stress, I smoked a lot fewer cigarettes than before. I plan to re-quit for health concern. The hospital has a good cessation program. I feel encouraged with the counselor, and I can resist the urge to smoke.
อย่างของผมนี่ก็คือจะเลิกกันครั้งแรกเลยนะ
Mr. Sompong Thonpan, driver. I got addicted to smoking from friends in my teenage years. Now, after smoking fewer cigarettes, I feel better. I am trying to smoke less and intend to quit entirely for the better health of surrounding people. Having this kind of program at the hospital is good. Service recipients can ask for advice and then participate in the tobacco cessation program at any of the hospital's chronic disease clinics. All hospital staff are ready to give advice and refer the patients to relevant units. Relevant personnel will use the knowledge or principles gained to help the patients who wish to quit smoking to know and understand the tobacco cessation principles and practices. With encouragement and collaborative follow-up support from all units, the cessation program will be beneficial for such patients as well as those who are at risk of chronic illnesses.
ทั้งคนที่มาเช็คอัพพยายามที่จะโน้มน้าวว่า
Professor Emeritus Dr. Kunnantha Maranet, respiratory disease and tuberculosis specialist. We pay attention to smokers with risky behaviors, but having not shown any symptoms, giving them a pulmonary function test. They are lucky as smokers, but their lung function is normal. But if their lungs begin to be abnormal, they can be treated and feel better if they quit smoking. That is the truth given to the patients. They need to love themselves, help their families and the country in terms of medical expenses. Regarding tobacco cessation, we have to work reactively and proactively through collaborations of personnel at all levels in the continuous and concrete manner.
ในส่วนของทางระบบ
Dr. Pontip, neurology and stroke specialist. As a stroke specialist, we have found that about half of stroke patients are smokers. It is easy to convince such patients to quit smoking as they have been afflicted with a tobacco-related illness, and they have realized that it is time to quit. There are options for the patients to quit voluntarily, by themselves, or with medications. Helping them through the tobacco cessation clinic is an option using a proactive approach.
ต่อหลอดเลือดก่อน
As for smokers who need smoking cessation drugs, there will be a medical specialist to give consultation and treatment in collaboration with other relevant multidisciplinary professionals such as pharmacists. This is just one of the activities undertaken to assist smokers to choose a quitting method that is suitable for themselves. A survey of the environment surrounding the hospital is another key step undertaken by the Tobacco-Free Hospital Committee, comprising personnel from various sections of the hospital. Today, staff from the hospital's Environment and Safety section is conducting a survey on the number of cigarette butts. This kind of environmental data will be an indicator for determining the effectiveness of the anti-smoking campaign.
ที่มีอยู่แล้ว
จิรพันธ์ไหมตะ Manager Quality Management Section Paolo Hospital พหลโยธิน As the environment affects patient care and personnel of the hospital, if the smokers are hospital staff, we will have a stop smoking activity for them. But if they are patients and relatives, we will tell them that this is a non-smoking area. Moreover, in a certain area, smoking is prohibited as it is near an oxygen tank.
ด้วยนะคะว่าผู้ที่ถูก
After conducting the environmental survey, data processing was an important step, and the data were forwarded to the Executive Working Group for use in action plan revision. Through the coordination efforts of Dr. Araya, the group has been working smoothly within the hospital and together with other private entities at the national level outside the hospital. Today, another meeting is being held for the Thai Physicians Alliance Against Tobacco, comprising doctors from both public and private sectors. The alliance serves as an important tobacco control network that has been working collaboratively with civil sector organizations since the beginning of the awareness of Thai society on tobacco control, as smoking is the cause of NCDs in Thailand.
สมาคมแห่งประเทศไทยเนี่ย
Professor Emeritus Dr. Somsi Paosawat, President of the Thai Physicians Alliance Against Tobacco. We have invited Dr. Araya to join us in the tobacco control effort because she is a diabetes expert and has been very active and efficient in making her private hospital become interested in smoking cessation. The hospital's work on this matter has been so outstanding that it has been given a Tobacco Control Award. And it is a good example showing that despite being a private hospital, it is able to make smokers quit smoking. Their work has been actively performed with a voluntary spirit for people's good
ก็
health.
จังหวะนั้นพอดีเลย
At present, the alliance's goal is consistent with that of the World Health Organization and Thailand's Public Health Strategic Plan, reducing the number of tobacco-related NCD patients. Thus, the Tobacco Cessation Project under the NCD Control Program has been implemented since 2012, involving the capacity building for stop smoking teams and the creation of standards for smoke-free healthcare facilities at all levels across the country.
เชิญชวนเครือข่ายทั้งหมด
Professor Dr. Ronachai Kongsakon, Secretary General, National Alliance for Tobacco-Free Thailand. Technically, if we can make the people realize the health risks of tobacco, the burden of non-communicable diseases will drop markedly. Then the doctors can usefully spend their time treating other illnesses rather than treating tobacco-related diseases. The promotion of smoking cessation requires several in-depth working processes. We need to bring smokers into the technically correct and efficient tobacco dependence treatment system so that they will be able to quit smoking.
มากนะครับถ้าเราสามารถ
Therefore, Paolo Hospital, Pahonyotin, is an example of private hospitals with tobacco cessation program that meets the tobacco-free standards established by the Thai Physicians Alliance Against Tobacco Its aim is to become a model for encouraging the people to be free of smoking hazards that are the cause of non-communicable diseases.